health experts are concerned about the mental health issues of students and teachers and the high demand of counsellors and psychiatrists. We are certainly seeing an increase, and Commission data reveals that Lifeline Kids Helpline and also Beyond Blue fielded a record 112,000 calls for help last month alone. That's a 23% increase more than January of 2020 before the start of the pandemic, and 38% more than in January of 2019.
For more, we are joined by Malcolm Elliott, President of the Australian Primary Principals Association. This is a huge issue, Malcolm. A very good morning to you. And look, those children or those people that have a propensity to mental health problems, this is just flying through the roof and exacerbated by the fact of everything surrounding this pandemic.
Yes, that's certainly the case, Tim, and it's very concerning for all of us, whether we're teachers, parents or members of the general community, to see the impact of mental health issues playing out now in schools every day is a deep concern.
And Malcolm, you've been calling for greater resourcing in schools over the past 18 months. What are your main concerns and what extra help are you wanting?
Our main concern is that when children are presenting with mental health issues, and we've seen an increase in the numbers of particularly primary-aged children, our association is particularly interested in that particular sector of education, that when referrals need to be made, unfortunately, despite everyone's best efforts, the people aren't there to actually refer to, and that the time it takes for appointments to be made and then appointments to be filled is just far too long. Their children need help immediately, not in 6 weeks' time or perhaps even 6 months' time. It has to be timely, it has to be consistent and repeated in order for the difficulties that the children face to be remedied.
Yeah, we have to see government intervention, don't we, to medical professionals, that this has got to be a priority. We can't go and see someone or have someone seen in 6 weeks' time. It needs to happen now, just as important as vaccination is. And the misinformation, the misreporting, the messaging coming from government, which is has been all over the shop, and understandably because it's something so new, but it's confusing children enormously because they're going, I thought that was a hotspot, but you came in from the hotspot. This just plays on itself.
We're in extremely difficult times, Tim. It's hard enough being an adult, fairly well balanced, let alone be a child trying to make sense of what's going on. And of course, before the COVID pandemic struck us, we were dealing with the impacts of bushfires, drought, the characteristics of Australia's weather, climate change, and we're deluged, not to make a pun there, but we are deluged with information of various types about what's actually happening, and this is extremely confusing. Then you throw in things like school closures, things being different in one place from another, and this is terribly difficult for young people to cope with. What we really need now for our young people is a sense of consistency. We also know that for too long there's been an underinvestment in mental health support in Australia. This has just got to be fixed, and we can refer now to the findings of the Victorian Royal Commission recently, saying that unfortunately the systems are built around crisis intervention, and where we must be going now as a nation is towards prevention. We must make sure that we're doing the absolute best we can to present ourselves in an optimistic and positive way for our children, and that all the services that we need for parents and for children are available at all times to make our society as strong as it mentally can be.
Because really there's no off button for children, for anyone. You've got your phones 24/7. We had bullying at school. They've got online bullying, so it just continues, as we all know. In your experience, in your work, like what have you seen in terms of the intensity? Because, I mean, you would have to say that children these days are just dealing with so much more.
Absolutely correct. And it's very, very hard now for parents to be curating effectively the contact that their children get. I must say that personally I was no fan of social media and the availability of it to young people. Having a conversation not too long ago with 5 primary school aged children, 3 of whom already had access to social media, and another youngster who was about to get a telephone and access to Facebook. none of these people were 13 years or older, as you're supposed to be, in order to access these things. And it was clear from the conversation that their parents were really struggling to manage the children's contact via social media. This means that the children are incredibly open to abusive relationships. And we also have to remember that they're not ready psychologically to deal with the complexities that come up via these things. And it's clear that children have a lot of difficulty turning devices off and turning away from negative influence. That in itself presents a complexity. Then you add in what we're seeing in the general media and where we're turning to for what we might consider to be, hard evidence and good news. Then it's a very, very complicated set of circumstances for young people to try to navigate, and very, very difficult for their parents as well.
And we could almost start from a basic template as adults, as parents, that we need to keep their lives as innocent as possible. And what I mean by innocent is just playing the game of being a child, allow our children to be children. Malcolm, it's always good to chat. As a parent of 3 children, Janie's got 2 herself, they're all at school. These are big issues and it's great to get it out there. Thanks so much.